I was raised in Oregon, in the suburbs of Portland. I played sports my whole life, football, basketball, and track, and was fortunate enough to be invited as a walk-on wide receiver to the Oregon State Beaver football team. And I played there for 2 seasons before my passion really shifted to medicine, and I sort of stopped playing football as a way to really kind of dedicate myself to the academic and pre-med track that I was on at the time. And it was really, my major at Oregon State was exercise and sports science. And it was really that mindset and that framework of exercise as medicine that had me thinking as preventive medicine, which eventually led me to naturopathic medicine. And then, through my journey there led me full circle back around to now doing what is essentially naturopathic sports medicine. And so, I was very lucky that the naturopathic college is in Portland. I'm very fortunate that my family still lives around in the area, and I have a really strong relationship with them, and really happy to call Oregon home. All right, so my training includes a doctor of naturopathic medicine, and then I got was a highly competitive accredited 2-year family practice residency after graduating, where I spent 2 years seeing really any person for anything, people of all ages for really any condition, just doing a neighborhood family practice. And that was really helpful for me to build a foundation of just strong patient care, being able to have the confidence to see a baby with a fever and an elderly person with dementia and a middle-aged person with diabetes, and really kind of everything in between. And so that's really kind of where I got my start. And even though I don't quite do that now, I'm very grateful to have had that experience. And it was actually through that experience, seeing people with joint and orthopedic pain as a primary barrier for the restoration of their health, that really got me thinking along the lines of specializing in sports medicine, where someone with diabetes couldn't exercise adequately because of knee pain, or someone with digestive issues couldn't do their daily walks because of back pain, or whatever the case may be. And so that really kind of got my wheels turning on really kind of specializing in how do we really help people non-surgically from a holistic point of view with the pain that's really crucial to their overall health. So after my 2-year residency, I began specializing in orthopedics, and for the last 6+ years I have done specialized orthopedic training, both head to toe, and also specialty training in foot and ankle sports medicine. Over that time, I've seen hundreds of patients, have done hundreds of injections and procedures, all related to arthritis, tendonitis, low back pain, nerve issues, really anything that is a cause of pain. And through that, I've specialized in regenerative medicine, regenerative injection therapies like platelet-rich plasma, prolotherapy, adipose-derived stem cells, or MFAT, perineural injections for nerve pain, natural foot and ankle health, as well as ultrasound. So I have a specialty in ultrasound diagnostics as well as ultrasound guided procedures. The RMSK credential that I have after my name is an expert level ultrasound credential, where everything that I do now is image guided for really precise placement of all the medicine, and also really a huge amount of diagnostic information. So we have the what is figuring out what's going on, and then actually treating it as precisely as possible through that ultrasound expertise. And lastly, I'm also currently the president of an organization called the Naturopathic Orthopedic Medicine Academy, or NOMA. And that just is a position at a nonprofit where we are helping to kind of raise the standard and train other physicians in this kind of medicine in non-surgical orthopedics. And it's something I enjoy doing, but also feel helps elevate my own practice, my own patient care. So what is my approach with patients? What does all this look like for you as a patient of mine? So my moment-to-moment perspective when I have a patient with any kind of pain is to be as laser focused and precise in the diagnosis and treatment of the specific physical tissue that we are concerned about, whether this is a meniscus or a labrum or a cartilage surface or a tendon or a ligament or a nerve or any number of different things, to really be just unrelentingly precise in the, like I said, in both the diagnosis, figuring out what's wrong, and then also the treatment, which is like, let's actually fix this thing. And at the same time, I always have an eye on the bigger picture of that this, issue in the tissue per se is connected to a human being, right? It's connected to this biopsychosocial model of the experience of the pain, the experience of the person. And so always keeping those two things in my mind simultaneously, I think really helps me to never forget that, when people are told like the pain is in your head, or they're sort of discounted in these sort of dismissive ways, that pain is almost always some part physical. And so there's something we can do to the physical body to modulate the pain receptors or the damage or the inflammation in the tissue, while also recognizing that people experience different levels of tissue damage differently, and their metabolism, their hormone levels, their diet, their history, their injury history, all of these things, which is more of their full story, that full human experience, all adds into what we're looking at in the tissues. And so sometimes that can just be how I talk to people. It may not actually manifest in what I'm actually doing. Like sometimes, a knee pain is just an issue in the knee, and we treat it as such. And oftentimes it can be a little bit more than that, but that doesn't necessarily mean that we do that much more. It's just, education is a big part of this whole approach, and really kind of empowering people through education often to, to understand that, even with an injury, it doesn't mean that you are broken.